Oregon has a long history, steeped in white supremacy, with vanguard laws, beliefs, and violence baked into colonization. White settlers were guaranteed land to help create a racist white utopia, while Black folks and other people of color were stripped of their basic human rights. By 1959, there were finally some shifts. The Oregon legislature ratified the 15th Amendment, which disallowed racialized voter discrimination. That was only 90 years after federal adaptation, but the culture built from a foundation of white supremacy and its predominantly white population would remain. Our guest today, Violet Larry, was born in Oregon in the early 1960s. Her father, a master baker, would be one of the few trailblazers that traveled from the South to optimistically challenge an oppressive culture with lessons learned from years of living under Jim Crow laws. His pioneering spirit would come to have a noticeable effect on Violet.
He taught us to be accepting of others, but to always also be cautious of others.
Ones that Violet was raised to never blindly follow.
Dad never forgot Montgomery, Alabama, where he was born and raised, and all of his experiences and his stories. Like, how far do I trust you? How far do I trust you as a white person?
Despite harboring distrust within the predominantly white county he resided in, Violet's father remained steadfast in his efforts to save money and acquire land. Alongside his wife, they took deliberate steps to attend a predominantly Black church in North Portland, making the roughly 40-mile journey regularly. This commitment reflected their prioritization of a strong connection to their Black culture, a priority Violet would continue for the rest of her life. However, as a Black family owning land in the area, this unique circumstance left fellow churchgoers understandably perplexed.
We happened to live out in Clackamas County. A lot of Blacks thought that we had money. We didn't have no money. My parents were hard workers.
That commitment to hard work would also translate to Violet. Just like her mother, she would enter into a career as a nurse, joining a field where she would use her agency to advocate for underrepresented communities.
The medical system listens to nurses' voices.
Welcome to Black Care Matters, the show where we honor the unique experiences of Black nurses working in the Pacific Northwest. I'm your host, Rashida Quinn. In recognizing that Black lives matter, it's crucial that the care for these nurses also matters. Cultural white supremacy has had a detrimental impact on the American healthcare system. Each nurse's story reveals rich insights towards the possibilities of a better future. Today, Violet shares with us her unique path as a nurse dedicated to community health. From the hospital to the homes of mothers caring for new babies to the cafeteria of elementary schools in East County, Portland, Violet is a fierce and joyful advocate for positive health outcomes in the Black community. Her energy hits like pumpkin pie on a holiday. I felt warm and cared for in her presence. You don't want to miss this conversation, right here on Black Care Matters. I know one of the things you like to do for joy is baking.
It is.
Raisin-free cinnamon rolls are your favorite.
Definitely. No raisins. No, not in cinnamon roll. But there's just some joy in getting my hands messy. I don't mind dirty hands in the kitchen.
So what about that experience brings you comfort?
Well, for me, my father was a master baker, and it was so much fun creating something and then having him there to critique it.
And what did your dad like to bake?
He was the maker for a Russian Viennese bakery, Jewish. And so he made the best challah in the world. It was fun growing up as a kid.
I love that. And I know your mom was a nurse.
Yes.
What did she do for comfort after a long shift of nursing? Was she into baking or
Not at all.
No.
Mom said there's one baker in the household. She's the person who would cook all the time, and she's the social one. We always had people at our home.
Yeah, speak a little bit more about growing up in Oregon and that experience.
When I look back, it's like, I have lots of little stories. My parents, neither one were from Oregon.
Okay.
My grandmother also wanted to be a nurse. So in the 1930s, she enrolled in a nursing program and was told they'd met their quota.
Wow.
The 1950s, Mom had an advocate who said there's a nursing school out in Portland, Oregon. She came because there was another Black nursing student that they had accepted, and that nursing student needed a roommate. They didn't say, we want you because of your academics. It was, we have another Black nursing student who needs a roommate. I mean,
wow.
Imagine a white nursing student rooming with a Black nursing student. I didn't grow up in Portland. I grew up in Clackamas County. So all of my elementary school years, I'm the only Black girl, and my brothers are the only Black boys. And it's like, wow, that was a lot. You and your family carried the weight of that whole district. When you think about it, because there were no other Blacks, so they had nobody else to compare you to. So it's like everything they thought, perceived, was based on our family and our family's experiences.
Wow. It's isolating.
Yeah. But even though we lived out there, my parents made sure we came to Northeast for church, to visit people. We always had a Black connection. So my brother, he wanted to ride horses, and he went on to be grand champion for the state. We grew up going to the rodeo, being the only Black people out there at the rodeo.
That's such a rich experience. I mean, your whole family were trailblazers in that sense. Arts, dance, horses.
The more I look at it, they weren't afraid of letting us try new things.
How did you come into nursing?
I wasn't going to be a nurse. Grandma was going to be a nurse. I have aunts who are nurses. We didn't need another nurse in the family, I thought. And my mom is the one who's talked about the ability to be able to talk to people and educate and see change and progress. It's like, okay, if I'm going to do it, I want to do community health nursing.
That's the position that you ended up in the longest?
In the longest, yes. I started at the Veterans Hospital because 40 years ago, they told you have to get hospital experience to be a true nurse. And I worked there for about 7 months on the GI floor, gastrointestinal, stomach stuff, liver stuff. I had my first AIDS patient there. Back then, it was like, he was all the way at the other end of the hallway by himself because of the unknown. We just didn't know enough about AIDS at that time. We've evolved so far, and I'm so grateful. From the Veterans Administration, I went to Oregon Health Sciences University, their mother-baby unit, and I took care of postpartum moms and their babies. And I was there for 2 years before going to Multnomah County Health Department's home visiting program.
Oh, okay. So the home visiting program, can you describe a little bit about the day-to-day experience?
I didn't know what I was doing. Because the hospital is totally different than public health. The hospital, everything is there. Then you do this, then you do this. What I found in community health nursing is advocacy is so huge. My client base was pregnant and parenting families.
Okay.
And so you go into a home, you have a referral saying this mom is due. she's, 20 weeks pregnant. And you plan out, okay, we're going to do some prenatal education about the childbirth experience, what to expect. How do you breastfeed? Who's your pediatrician going to be? Do you want medication? And so having to learn to meet families where they are and embrace no matter how they got there. It's not for us to judge. It enables you to build that trusting relationship. One story was I was pretty young in my public health career and going out on a home visit and seeing this baby was pretty lethargic, sunken eyes and barely crying. On our home visits, we would take out scales, weigh the baby. The weight is going down. Talking to the mom, and the mom is saying, well, no, she's not eating, and she's not having very many wet diapers. And then saying, well, have you called your doctor? I have an appointment scheduled, but I'm scared to take my baby to the doctor because I think they're going to judge me. Being able to say, that's why I'm here, to help support you.
Yeah.
I'm going to call your doctor, tell him I was out here today. This mom and baby need to be seen today. Oftentimes we think, how could they ignore their child that way? They're doing all they can with what they know. But the system has families so fearful of when I do come, are you going to take my baby away? Or are you going to really support me in having a better outcome for my baby? And that's where that advocacy that you can provide as a community health nurse. And nurses' voices matter. The medical system listens to nurses' voices.
Wow. So it sounds like a big part of the job was being present for the reality that you were entering. So you were the in-between that was kind of the gap that's missing in the whole system.
Right. And one thing I've learned that we can't assume that because you're married or you have a partner and you have a degree and a good job that you aren't affected by the racial bias in the healthcare system. My daughter, who's 38, she has 2 children. With her first child, we didn't think she needed to be part of a culturally responsive home visiting program, the program that I'm a part of, Healthy Birth Initiatives. She's married. She has her degree. They own a home. She has a job, and she has wonderful family support. Why would she need to have any additional support? She went in for a dental appointment, and they noticed her blood pressure was high and ended up with everything. Preeclampsia, she hemorrhaged. She had every side effect that she could have with this little guy. He was born at 34 weeks, just this little thing. They were feeding him through a little tube, but we didn't think she needed any additional support. 4 years later, she's pregnant again. Okay, let's sign you up, Healthy Birth Initiatives. And her words were, Mom, I had no idea what having a Black nurse visiting with me would do. Just having somebody of color to understand and relate. So for Black women, it doesn't matter your socioeconomic status as far as the poor birth outcomes.
Right.
There are no protective factors for us. Education, healthcare, it doesn't matter. And so we need that additional support from people who look like us. Not every Black person is going to connect with every Black person, but to have the option and the opportunity, it made a difference.
Right. What you're saying is so true. I mean, we saw that with Serena Williams' story
Yes.
of her birth. It doesn't matter the socioeconomical place that you are in. We still live in a white supremacist culture and in a healthcare system that has not prioritizing our health needs in the same way that it does its own white counterparts. I'm glad to hear that even in your sharing of like, I was a nurse and I had this education, it still made a difference.
It still made a
to
difference.
have that support.
It's okay to have supports outside of your family.
Yeah.
And so often as Black people, we stick within our family. That's our community.
Right.
But there's other community that can help us. It's okay. It's okay.
In your experience with visiting homes of strangers and having white community that you were serving as well, did you experience racism or people that were less receptive to your support?
You know, overall, it was a real good experience. But as I look back, there were some homes where it's like, I don't know if we're coming back. And the families never came out and said, I'd rather you not continue working with us. They would just avoid. It was more kind of a passive, which worked out okay for me. But it's that anticipation that as Black people we have when we're going to different communities.
Absolutely.
It's there.
Right. So how many years between this type of nursing and then you move into school-based health?
I got the position as a school nurse. So it's not the traditional school nursing, it's the school health clinics. And so I was at Lane Middle School in outer Southeast Portland, very impoverished neighborhood, and I loved it. I always liked middle school kids, learning the kids as they'd come down for whatever reason, trying to figure out what connection can I make with them beyond them just coming in and out of the clinic. And school-based had a nutrition program. And so I decided, oh, that's it. I'm going to offer nutrition education at lunchtime to these students. You know, like 6 to 12 students who would come on their lunchtime down to the little health clinic, and they'd bring their lunches because that was the requirement. It was so much fun. The kids just opened up and they came consistently. They'd go back and share with their families what they were learning. It spoke volumes around relationship building and trust. Budget cuts led to my not being able to continue in school-based health clinics. And that's when I ended up going back to home visiting with the Healthy Birth Initiatives program.
I see.
Yeah. Otherwise, I probably would have ended my career in school-based.
School-based. Well, it sounds like relationship building and trust was this consistent piece of your skill set where resources are scarce and maybe that one-on-one attention is less available. It sounds like you really provided those spaces.
As I hear you say that, it's like, I did do that.
You did do that.
You know, and it's just part of who I am.
Were there any points in your career or experiences where you just felt very challenged and maybe even overwhelmed?
Yeah. I mean, I think of the last 5 years especially. It brought my voice forward. Somebody saw some leadership abilities in me and encouraged me, go ahead, apply. I want you to be the supervisor. It was very challenging initially because I was unsure of what it was that I was supposed to do as a nursing supervisor. So being able to hear the concerns of the staff, remain neutral, but make sure the work moves forward. And I was able to find my voice and not be fearful. The more you talk about what's happening to me, my daughter, my sister, my friends, it's personal. And so it allowed me to start saying that this is not okay. We can't continue to do it this way. It's easy for me to say, no, it's because of racism. It is because of racism. But it's been difficult to sit in spaces where people on the other side of the table aren't quite ready to hear what you have to say.
Right.
But you know you have to say it. And the more you say it, the more they hear it. And then that's when it's like, okay, you're in my corner or you're not.
When you're working in the community, and I know you've mentioned that you wanted to be present for Black community members, you sought out experiences so that they knew there was a Black nurse that, you know, they could have access to. How do you feel that impacted your experience and theirs?
I knew Black nurses, and I would have loved to have had a Black nurse on the floor to kind of like be a mentor, even if it wasn't in a formal way. I said, I'm going to be that mentor. So any Black nursing students that I come in contact with, I want to make sure that I'm there to support you. Initially, my work wasn't, Black African-American focused. So I was seeing everybody. But then as I grew in my career, it's like, there's not even a Black nurse in East County. So I made a conscious decision to leave the Northeast team and go to the East County team because I wanted families to have an opportunity to have a Black nurse if they chose to.
In white communities where you are used to being the predominant culture of the space, whether you're in the patient realm or as a care provider, you take for granted how much more ease you move through the space because you're working with people who reflect your culture. We have data that this actually affects your health outcomes in dramatic ways. And especially when you add the history of intentional abuse that was already in the fabric that people are trying to recover from, I think it helps for Black populations to know that healthcare providers within the culture are also looking out for them, like that you're looking for me and I'm looking for you.
And something I've just recently noticed is that for staff also, it's really important to have a supportive environment of people who look like you. When you're the only one, the only Black in a white system, you begin to embrace that system because that's what you've seen. It's no fault of your own. It's the system. We have to somehow rally around each other as Black nurses, Black educators, Black leaders to support each other and not feel like we're not doing our part.
Yeah, I mean, this is powerful. We're in a space where our strength is saying no, setting that boundary. Any specific part you would add in terms of what you would shut the door on in terms of racism and white supremacy?
We don't have to say yes to everything. Saying no is a complete sentence. No. I'm not going to do that right now. Because more often than not, that extra is their work.
Right.
It's not my work. And so I'm not going to continue to do their work. You don't have to. I really feel like it's our time. Don't be afraid. Embrace the moment, knowing there are others who are feeling like you and have your back.
I love that because to me, that's sort of shutting the door on the expectation that I'm here to serve you. And so I'm done. I'm going to serve me.
Yes. That's the part that's hard to get to embrace fully. That if I don't do this, what's going to happen to me? You're going to be okay because you have the power. We have more power than we realize.
Right. What you're saying also brings to mind the ways we go above and beyond. We've always been forced to overachieve, to be able to be counted, to be heard, especially being in a predominantly white state. We do need allyship, right? Especially in a white community. There's got to be a connective piece so that you, as the dominant culture, are dismantling white supremacy and learning a new way and implement that into building relationships. This is how we all move up together. You know, the white person that has not done that investigation of themselves into a tailspin, and that reaction can be dramatic.
True. We just have to change the narrative.
Yes.
And we're slowly getting there. We bought into the labels, strong black women, strong black women, strong black women. And so we just feel like we just had to keep on going, keep on going, keep on going. But we do have to take that time, and it's going to be okay.
Yeah.
They do value you. So go ahead and take your time.
So if you could do it all again, 37 years of nursing, what would you do differently knowing what you know now, if anything?
You know, I really think my path has been amazing. It's been a good trajectory and wonderful experience.
Listening to the story of Violet's grandmother and mother, who were only allowed into nursing school based on a quota of Black students, brings to the surface a raw anger about how Black people have been subjugated in America. In Violet's experience in the profession, the lack of representation remained. She expressed how she would have loved to have a Black nurse mentor. There wasn't one, so she became that mentor. It draws this parallel between the ways white supremacy culture restricts the growth of the Black community, and there are real consequences for this system. We can see how many Black communities still suffer today. But on the other hand, her story highlights the resiliency, albeit forced resilience, of the Black community to increase and show up despite the toxic efforts of this oppressive system. Violet showed up in homes throughout East County, monitoring babies and mothers. She showed up in schools, teaching children about nutrition. She showed up as a supervisor to advocate for other nurses. She was relentless in her pursuit of Black community health. This spirit of relentlessness so inspires me. As a mother of mixed-race children and an advocate for the dismantling of white supremacy culture, I will remember Violet's tenacious spirit and add it to my own arsenal of tools. How are you relentless when building a more inclusive and diverse community? How do you pierce through the system and blossom anyway? Thank you for tuning into this wonderful conversation with Violet. Please join us next month as we delve into another Black nurse's story, gathering more rich insights to take with us into the community. Black Care Matters is presented by the Alliance of Black Nurses Association of Oregon, sponsored by the Oregon Center for Nursing, and was recorded at KBOO Studios here in Portland, Oregon. This episode was produced by Ida Hardin, with production support and mix mastering by Ramoy Phillip. Our executive producer and host, myself, Rashida Quinn. The Black Care Matters podcast website was designed by Brendan Quinn, with portrait art created by Ryan Alexander Tanner. Special thanks to Danae Hall of the Alliance of Black Nurses Association of Oregon, Kelly Castanegro, and our team at KBOO, Jezaniah Hawthorne, Zoe Ezekiels, and Selena Flores. This podcast would not be possible without the generous grant from Oregon Center for Nursing. Thank you to our grant team, Rick Allgeier, Don Schoenthal, and Callie Giesler. And here's a special invite to all of you, our listeners. Please engage with what you hear and learn on Black Care Matters. Did listening to an episode remind you of a racialized experience you had in healthcare? Did it strengthen your commitment to anti-racism in your own workplace or community? Did it bring up questions about how you can better speak out against white supremacy culture? Please reach out with your questions and comments at blackcarematters.org/contact. We would love to feature our listeners' feedback on a special episode of Black Care Matters. Your voice matters. Listen to Black Care Matters wherever you get your podcasts. And while you're there, why don't you leave us a review? Your words really do help us reach a wider audience. It's been a pleasure sharing this with you. We'll have a new conversation for you next month. Until then, remember, Black hair does matter. It's a matter of how we make those words count.